Hi everyone, welcome back to my service spotlight. I'm here with Kelsey Lewis, the Executive Director of Kids Who Count. I'm really excited to be able to interview you today.
Thank you for being here. We're so glad you joined us.
Of course, thank you. So first, I just want to know about you. Tell me everything about Kelsey Lewis.
There's nothing really interesting to tell. I've been in profit management for like more than 20 years. Really involved in organizations that work with children and families in the community. And I've been working in early intervention with programs that serve infants and toddlers with delays and disabilities since about 2009, so about 10 years.
Amazing. And then tell me a little bit about Kids Who Count, the organization, what it does, why it's profound.
Okay, so Kids Who Count has been around for 33 years. We received the early intervention grant through the Utah State Department of Health when Congress passed in 1986 the Individuals with Disabilities Education Act and extended that to infants and toddlers.
Yes.
So prior to that, children in school age would receive special education services, but not a lot was being done to really help those younger children. And what research and science has really shown us is that children need that support early on. 85% of brain development happens before the age of 3. So if we can identify a delay in development and help a child, get them the therapy and the services and the treatment they need before the age of 3, we can have a really significant impact on their developmental trajectory.
Amazing. And I don't think parents really know that their children need that intervention so young to be able to make that big of a difference.
Yeah, it takes a lot of education, and we serve really a broad spectrum of disabilities. So we might have children who are late talkers or late walkers, and they just need a little support, and you never see them in special education services again. And then we also have children who are profoundly medically challenged and whose disabilities require total care. And in cases like that, our role really becomes helping those parents optimize that child's development and support them, and also work through what their expectations are. I mean, when parents find out that their child has a disability, they are setting off on a journey that they didn't expect. And there are certainly joys, but there are challenges, and that's something that we want to help families get through and prepare for.
Yeah, and sometimes it's the little things like being able to eat on your own or being able to dress yourself.
Absolutely.
Yes, amazing. And then tell me, what inspired you to be a part of this? How is it personal to you?
Well, I anticipated becoming a therapist. I have a master's in social work.
Amazing.
And one of the things that I found when I was first out of college and working in the human services field is that without really good public policy and without systems and programs that are meeting the needs of families and children, an individual can't have a lot of impact. It takes an entire community. It really truly takes a village. And so I'm inspired by organizations like Kids Who Count and the people that dedicate and commit their lives to serving children. And so it's my honor and privilege to work with the most amazing team of professionals here. I think what's totally unique about Kids Who Count is we've been around since 1986, and we have some staff members who have been here since 1986.
Wow.
Isn't that unusual?
That's fantastic.
So unusual. And it's because for them, it's about the heart and the love and the service. And they choose this field. They love these kids and families. They've been a part of this community, and they see the kids grow up. And some of those kids are in their 20s now, and it's amazing.
Wow.
It's amazing.
Wow, and then you must be doing something right, because this is a hard field to be in and to work in, and so to really be in it for that long must mean that they have a program that they really love and is backing them up. That's phenomenal.
Yeah, great stuff.
How can people become to get involved in Kids Who Count? How can they donate? How can they help? Where are their services needed?
Excellent. Thank you for asking that. We always have a need for volunteer support. Everything from helping us do things just in the building, in the center, to helping with childcare when we're providing services here for children and families. And there is a significant need for donations. Although our early intervention program is funded through state and federal dollars through a grant, We're a nonprofit organization and we need additional funding to really operate those programs. And in the past 6 months, we've started an autism program. So we're providing ABA services, applied behavior analysis.
Yes.
And many of those services are covered through insurance. But to get that program up and running, there's startup costs, and we are not sitting on amounts of money. So we really depend on the community's support. People can donate right on our website at kidsaccount.org. There's a donation page. Through our Facebook page, they can donate. And yeah, we just appreciate any support from the community. Every donation really makes a difference.
Yeah, and I mean, imagine if every person was willing to give just $5 a month.
Huge.
I mean, instead of getting a drink at the gas station maybe 2 days a month, to be able to give that money to children who really, really need it.
Yes, those recurring donations, making a monthly, even like you said, $5 donation is huge. The impact is significant. I think it's December 3rd, Giving Tuesday, the first, if you're familiar with Giving Tuesday, the first Tuesday after Thanksgiving. For the first time last year, we participated in Giving Tuesday and raised almost $7,000.
Wow.
It was wonderful from the community's support. And so we encourage people to support Kids Account for Giving Tuesday. We're in this community, we've been here for years, we're having an impact on children and families. And we just really appreciate the support.
Yeah, well, and most likely people who are donating, they will have known someone who's been affected by Kids Who Count. They will know a neighbor or a friend or a sister or brother who's had the opportunity to be here and develop through this.
It's true.
Yeah, so
it's absolutely true.
Are there any last thoughts that you'd like to share?
If I would say to parents, to anyone, if you are concerned about your child's development, if you have any questions, call us. An evaluation is free, it doesn't cost anything, and if we identify an area of concern where you really need support, we can help your child. So
yeah, awesome. And whether they do need that intervention or not, it's just nice to have that peace of mind to be able to have that evaluation.
Absolutely.
Awesome. Well, thank you so much for coming and speaking with me.
Being here. Really appreciate it.
Thank you.